Affordable health care. Well, if you're going to be talking about this period of time in the life of this country and all of our lives, who better to ask that of than one of my favorite doctors? We've done radio and television together, Dr. Michael Christopher. However, it's not the most important thing you do, working actively as you do in the emergency ward at St. Joseph's Hospital. The official title?
At this point, I am an emergency physician, and I'm chair of the credentials department, former chief of staff. I did that for 4 years, and founder of the group there, the emergency medical group.
So what a perfect position for you to be in, to be able to explain every facet of the affordable health care program that this past week or so was presented to the American public.
I will say that I tried to read that 1 foot stack of paper, and my head exploded. And it was incomprehensible, really.
Have you been able to determine what it fixes?
It tries to fix several things. It is a fix. I'm not saying that it's necessarily the best fix in my mind. I think it's very difficult to understand exactly what's in it, even after a year or so that it's been passed. The thing about it, it's sort of the legislation that keeps on giving. Because of the 2,400 original pages, there's now over 10,000 pages of regulations that have sprung from that. There are many passages in there that said the secretary shall, meaning Secretary Sebelius, Health and Human Services. The secretary shall determine this, the secretary shall determine that. And from that, there have just been enormous amounts of additional law, and there's more to come. So we still don't even know exactly what's in that thing.
I think that that's what happens when any government gets involved with any process. No matter what, it seems to wind up with thousands and thousands of pages.
Complicated.
There is a generality, and I don't know that it necessarily is accurate. It's so easy to do cheap jokes about government activities and government and its inability to fix things. But when it comes to health care, I think the generality that is made is keep the government out of medicine. Keep the government out of health care. They'll just botch it up. But every other industrialized country has a health care system where the government is actively involved, except us.
Not so. We have Medicare and Medicaid and access in our state.
And do those work?
Well, they're nearly bankrupt, but they're in medicine. And I don't know what the percentage is, but half or 60% or even more perhaps of medicine is government. They're the largest payer that we have.
But we don't have a national health care system like
don't.
Switzerland, like Germany, like England.
We don't. And we have a private-based system that has evolved, and the government system on top of that. And I would sure like to see the components, the good parts of the private system preserved. I don't want to throw out the baby with the bathtub. And that's what's lacking in these other countries that you've mentioned. And I have traveled in England and in Australia and in New Zealand. I've toured hospitals there. I've spoken to physicians there. Certainly, the patients and the healthcare system there too. And I see what works well and what doesn't. And access to care they've solved that. That's good. That's what we need. We've got that 30% or so of the not unemployed, but uninsured or underinsured people in this country that just simply don't have access to care. And as an emergency physician, I'm on the front line of that. I see that every day. And it's actually my honor to take care of those patients. And I feel bad that we don't have a system that adequately covers everybody and that provides for preventative care. That would be such a wonderful way to control costs, is to nip a disease in the bud so it doesn't develop into something more serious. So I want to see our system take the best of what we've got in the private world, take what the government can do. Certainly there's Medicare is not going away. It's actually popular. It's one of the popular programs as far as entitlements go. But we've got to find ways to preserve it so that it doesn't go bankrupt.
So you tweak it right now, because we've only got a moment left, and let's find out what the Christopher plan would be. Taking the plan that was just approved and tweak it so that by 2020 we can have the best.
I don't know if tweaking is going to do it. I think we need a do-over, to be honest, to do it right. But I would like to see liability reform so that the cost of defensive medicine is taken out of the equation. There are so many tests that are ordered unnecessarily. We need medical records that communicate with one another so that duplication is eliminated. There's so fragmented in our system right now that scans are repeated and unnecessary. Blood work that was done a week before is repeated, and it's just not known. Nobody talks to one another. They just don't have a way to do that. That would help. Opening up insurance markets so that we could purchase insurance across state lines. That would be a simple thing to do and bring competition in. I want competition to make medicine better because that's what brings out the best in
When
everybody.
you see Dr. Michael Christopher next, I hope it's in the lobby of St. Joe's, so you can just wave and say, thank you very much. It was very, very interesting when you were on Pat's Personal Portrait on KTAR.com. That's as opposed to seeing him in the emergency ward of St. Joseph's. Nice to have you with us.
Bye.